Now B. All right, everybody, we are getting ready to go live on. We're going to start this in a minute. Give everybody just a few more minutes to get started. Like I said, if you're just now joining us, please remain muted. We're going to ask when we start having questions, we'll ask you to put those in chat and we'll try to monitor those as best we can. We're still getting some more come in. All right, I'm going to go ahead and get started with our introduction. So we want to welcome everybody tonight and thank you for attending the Southeast Arkansas Regional Library's first town hall meeting. My name is Judy Calhoun. I am the Regional Director for the Southeast Arkansas Regional Library System. And our objective tonight is to address any concerns over hesitancy over receiving the vaccine and to maybe help provide information on getting vaccinations. Before we begin, I want to thank Jennifer Knight. She's the region's new digital services coordinator and will be helping serve as Zoom and Facebook moderator tonight. She's going to help me keep track of questions, and please just make sure, like I said, type your questions in the chat box in Zoom or Facebook. Jennifer, why don't you say hi to everybody?
Hey everybody.
All right. Well, our special guests tonight are Drs. Jim and Katelyn Carmical. They are both family medicine physicians in Monticello, Arkansas. They bring their passion and drive from the John Peter Smith Hospital from Fort Worth, which was the Washington Worth. I'm going to get this right here a minute. The Washington Monthly chose as one of the #1 hospitals in America. Jim was raised in Southeast Arkansas and graduated from Monticello High School in 2006. Then he went to Mississippi State for college and then UAMS in Little Rock for medical school. And that's where he met his lovely wife, Katelyn, or Katie, in residency. Katelyn is the daughter of 2 high school teachers and coaches from DeSoto, Missouri. And it's a small town of only 6,000, so she is used to small town life. She went to a combined medical school program and graduated with her MD at the age of 25 and met her husband in residency. She was the house staff president during her time at the John Peter Smith Hospital. They have 2 children, Kit, who is 2, and Boone, who was just born last week. Those who got to come in early got a glimpse of the new baby. So they are excited to announce their new clinic that will be opening this fall in Monticello, the Woodside Medical. Some of y'all may have seen some advertisements back. So welcome and congratulations on the newest addition.
Thank you.
We're excited to have you here. So, but why don't we just start off and talk about a little bit about what are the differences between vaccines? And like I said, anybody's got questions, please, y'all just post them in chat so we can look at them, okay?
Can we talk about this?
Sure.
Okay. So there's a lot of vaccines out there, and the 3 we're going to really kind of talk about are the 3 that are available here in the United States. As far as like AstraZeneca and some of the other ones that are maybe you hear news reports about and everything, those are overseas. We don't have it, so we're not going to waste time on it. We're kind of talking about what's available here. So the 2 that you hear the most about are Moderna and Pfizer. Those are mRNA vaccines. And then the other one is the Johnson & Johnson vaccine. That is a viral vector vaccine. And I can go into that a little bit and kind of just don't want to bore people. But we did want to talk about that a little bit as far as what those mean. So when you're talking about an mRNA vaccine, mRNA is messenger. It stands for M. Let's see if y'all can see this, but it's mRNA. And that's for messenger. And the reason it's the messenger RNA is when you have your DNA, that is the code that makes everything in your body, right? Your DNA opens up inside the center of the cell, inside of what we call the nucleolus, and the mRNA binds to codes off of that DNA. So when it opens up, the mRNA binds to that DNA to get its code, and then it leaves the nucleolus and goes out into the cell. And then in the cell, the mRNA goes to the ribosomes. And if you remember from your high school cell lectures, right, the ribosomes are the manufacturers of the cell. So those ribosomes take that piece of DNA and all the little codes on it, and it uses that to build something. So mRNA is essentially a blueprint for a ribosome. So when we're talking about an mRNA vaccine, what we're talking about is they figured out what the body, in this instance, what the body needed to attack to be very effective against COVID. When your body makes antibodies to something like COVID, it might attack the body of the COVID. It might attack like an appendage part of the virus. It might attack all sorts of things. But what we learned was if it attacks the spike protein that's on the outside of COVID, it's very, very effective. And so what they actually built was they reverse engineered that protein. Let me get the bait real quick. We reverse engineered that protein for the spike protein to create the mRNA that would make it. And then that was encapsulated inside essentially a little ball of fat, and that's what goes into the vaccine. So then your cells, it uptakes that mRNA, and the ribosomes of the cells produce that spike protein. And then your body doesn't know the difference between that spike protein on COVID virus or the spike protein being just thrown out into the rest of the body, builds immunity to it. So it doesn't ever go into the DNA. You've just bypassed this whole step, and you've created something that the ribosomes can produce. And then your own body makes the antibodies to attack it. That's how Moderna and Pfizer work. While Johnson & Johnson's a viral vector, and that's going back to more of like your traditional flu vaccine type virus, where they've taken a virus, basically an altered human adenovirus. They've inserted this piece of DNA needed to make that spike protein so that the adenovirus would display that spike protein. And then when you get infected or injected with the Johnson & Johnson vaccine, that adenovirus goes and spreads to the cells like a normal infection, and you just happen to build immunity to COVID while it's going through your body. So those are your main three types.
All right. So tell us, does the vaccine, because I know this is a big question right now with all the variants, do the vaccines protect against all variants?
So do you want to do this one, or do you want me to do it? You're a little busy right now. Okay. So it's kind of a loaded question in the sense of there's lots of variants that we don't have data for yet. Lambda, which is mostly in South America, is in the United States, but it's less than 1% of all cases. So we don't have enough data to say, does it work against Lambda? That it suggests so far that it is. And everything that you were talking about, like the original and Delta variants, the vaccine is very effective. If you look at Moderna after one shot, and it's a 2-shot vaccine, after one shot, it's 72% effective against Delta variant, symptomatic Delta variant. It's 96% effective against severe Delta variant. Pfizer, fully vaccinated, is 88% effective against Delta variant and 96% against severe disease. Johnson & Johnson is 85%. Now, it's a one-shot injection, Johnson & Johnson, so that's all. You don't have to worry about being fully vaccinated or not. You get it, you're vaccinated.
I do want to add, just with that first question, I think it's important for people to know that the technology behind the mRNA vaccine is not new. So this is the first one we've been able to actually use it on, but they've been studying it and doing research on this for decades, right, just kind of waiting for something to use it on. So it isn't totally new. We know what it's going to do. We know how it's going to work. We can predict that it's still going to be safe 10, 20 years from now. It's just that using this actual COVID in it is new, but the actual technology is not.
I think that was a big concern to a lot of people. They felt like a lot of people were scared the vaccines were rushed And
Right.
it is good to know that these were not rushed. This was science that was already being done for a long time before this virus came out.
Prior to this, there were mRNA vaccines for Ebola, which have proven to be very effective and very safe. It's just kind of a blessing that that's not something we have to worry about here.
That's right. So a lot of people wanted, you and I actually had this conversation early. How long does protection from the vaccines, how long will that last?
So we haven't been able to study it for prolonged periods. What they're saying right now is at 8 months, they're recommending a booster. They just now kind of got their head around how they're going to do that, and that's going to be coming down the pipe. It's a very complicated subject in the sense that you don't know if that would have been forever because of COVID alpha, but now you have different variants coming out. You have other factors playing into it. So because they're seeing some emergence of people being breakthrough infections with Delta, while it's still mild, they're going ahead and recommending that people get a booster to be more safe.
Okay, because a question from Facebook was Felicia Thompson said, why are they saying we need a booster now versus when you have the flu vaccine, you don't? And is it because the virus is adapting to your body so it won't fight off the virus?
So you do, I mean, we get flu shots every year. So we do boosters for flu for similar reasons, because there's lots of different versions of the flu. So every year when we get another flu shot, that's supposed to be against the most common flu we're predicting to face that year. And I want people like to draw that comparison of the flu shot to the COVID shot. These are really two different animals. But it's not that that COVID is figuring out your body. It's more that either your immunity may wane with time, which happens, just like we have to get tetanus boosters and things like that your immune system just can only have so many things on its plate. And so if it doesn't fight anything for a while, it kind of depreciates its response. The other side is that, yes, if everyone would get vaccinated, we could be probably done with this. When you have a large pool of people that are not vaccinated, it allows that virus the chance to mutate, evolve, and find a way around your defenses.
But she is right in saying that the virus is ever changing. You know, the virus, was just the alpha variant. Now we have the Delta variant. So it is changing. And that's probably why we need that booster, is because we need to strengthen our immunity to it.
Okay. So let's see, one of the questions, I've already had COVID-19 and recovered. Do I still need to get vaccinated?
Yes. So it's kind of the same thing. When you get sick, your body makes a defense to that infection. You don't know what defense your body may produce, which is why testing for antibodies isn't always the best method, because you may have made the spike protein antibody and you may not have made the spike protein antibody. And so you may have a different form of the immunity. But what we found is that people who get infected with a particular variant are basically about 88% immune to that variant at about a year, versus you're only about 40% immune to other variants. So the people who get vaccinated are much more protected against more variants than people who got the illness and got over it.
Okay.
Also, everybody's antibodies we're finding are there for a different period of time. So some people have immunity for months. Other people get it again in a very rapid period of time. So everybody's different. And since we can't predict how your body is going to respond to it, it would be the safest thing to go ahead and get the vaccine.
Okay. One of the questions on the board here is, I've heard lots of people, this is from Felicity Fisher, I've heard lots of people saying that the vaccine may cause infertility in childbearing age women. Can you talk about this?
So that was something that maybe I first heard a month ago or so.
It's been out for a while. People
So
have been saying
it's basically there's no data saying that that's true. it seems to be more fear mongering or something along those lines. We've addressed this with Katie's OBGYN. Katie got the vaccine when she was pregnant. I've had lots of friends that have gotten the vaccine and then become pregnant. There's been no data to say that this will cause infertility. And it's also one of, like when we talked about the mRNA itself, if you're worried about any effects from this vaccine, COVID is worse. Whatever you've heard, right, whether it's true or not true, the data consistently comes up that the side effects of the vaccine are less and less likely than the infection itself. And what we're seeing is that this virus is becoming more and more contagious. So if you're betting on, well, I just won't get it, that is not a safe bet.
I think a lot of, from what I've read, it seems that people are concerned about the spike protein aspect of the vaccine, and that being what causes the infertility issue. And that is the rumor, but I can tell you that it is absolutely unfounded. If you look at the American Academy of Gynecology and Obstetrics, there's been absolutely no evidence that it can lead to infertility. And again, that spike protein idea is no different. People have gotten their flu shots for decades and they're still having lots and lots of babies. And it's still that spike protein idea that's what it's attacking. So I think you can have great comfort in knowing that it will not affect your fertility. Not even should not, it will not. We did have the opportunity to get our vaccine about a week after I found out I was pregnant, and it was a very stressful time because, as all women know, that's a very big part of life. You want to be able to have healthy kids. But I spoke with every pediatrician I went to school with, every OB, every immunologist, and they all gave me great comfort in that, no, your baby's going to be just fine. What would be scary is being very pregnant at this time and not having your vaccine. Because the Delta variant is very hard. It's very hard on pregnant women and recently postpartum women. And going into this cold season, it's bad right now. I can only imagine what it's going to be like in December and January. And being really pregnant with a really bad virus when your body's already in an interesting state and it's swollen and it's hard to breathe and everything else already. You don't want to be.
Somebody wanted to know how long do you have to wait after recovering from COVID could you get the vaccine?
So if you just got COVID and you got over it, you can get the vaccine as soon as you're cleared to return to society. So normally 10 to 14 days after the end of from the beginning of your symptoms. That being said, if you did get the convalescent plasma or the Regeneron, the monoclonal antibody, you need to wait 90 days because those medications could disrupt your body's ability to build natural immunity. And it's another reason why people, just to emphasize, if you did get those treatments, you may very well not have built any of your own natural immunity because what those medicines are doing is giving you antibodies. And so you may not be any more protected than if you had never had the infection at all.
Okay, well, Robin Schaefer wants to know if you get COVID and then get the antibody transfusion, do you still need to get the shot?
Yes, so you need to get it, but you have to wait 90 days after the infusion.
Okay, that makes sense. All right, I'm still trying to monitor some questions here. Let's see what I got. So we've already talked about if you're pregnant, you should get the vaccine. So if you're sick, if this was a question, if you've got COVID right now, so you can't get the vaccine, you do have to wait until you're clear.
Yeah, if you're actively fighting it, you're not going to get a lot of benefit from getting the vaccine at that point. I think they did try that a little bit at first with giving the vaccine to people who were really sick, and it didn't show a lot of benefit. So right now the recommendation is to just wait till you're over the illness.
Okay, so tell us a little bit about the vaccine and kids. Are there different vaccines for different ages? Tell us what they're doing with that.
So right now there's only Pfizer approved for kids 12 and up. Moderna is still 18 and up. Johnson & Johnson is still 18 and up, maybe 16 and up, but it's adults only. there's some news that that's going to get changed this fall, that it may go down to as young as 6. But right now it's just 12 and up, and that's only with Pfizer. But the question on is it safe to vaccinate your kids? I would say yes, it's very safe to vaccinate your children.
Right now, what is the percentage that are getting the COVID variant that's going around right now? What percentage of those are children?
That's a good question. I don't know if I have a good answer for that as for kids. It's definitely, I don't know that it's higher than it was this winter, because we certainly saw kids getting COVID all last year and into the fall. What's different now is that kids are getting sick, like on ventilator sick. When we were in Little Rock with Boone being born, I actually got to see some of my friends who were PICU and NICU fellows, and I was asking them how it was, and they said that they had not had to worry about COVID until this variant came through, and now Children's is full of it, and unfortunately the ICU is full of it, and they have a lot of kids on ventilators.
Yeah, I think we heard today that the Children's Hospital ICU is full, completely full today.
Right, and that's a huge thing with COVID is it's not as a disease you get and get over. It really drags on, and it's an important part of this disease process, which is it really burdens the healthcare system, right? And so even though you may live through it with some of the treatments we have, or you get over it eventually, a lot of people are dying of other things because they can't get a bed. I mean, we're seeing people die of heart attacks and strokes and other diseases we could easily treat before this, but the problem is that there's nowhere to take these people. Katie's found something off of
American Academy of Pediatrics says that the week ending July 22nd, 38,000 cases were pediatrics. This past week, 180,000 of the cases have been pediatrics. That is a change from 14% whenever the pandemic began to about 23% at this time. And that's across the country. That's not just in our state, but that's across the board.
Interesting, yeah. But I think, like I said, I think we hear more about it because they're the unvaccinated, where the majority, or not a large majority of people are vaccinated. So we're seeing it more in kids. Whereas if it was combined with adults, it would be a lower percentage.
Yep.
Okay, let's see, what else? Let's see, we got a question here. Can you test positive for COVID after having the transfusion 3 months later?
So you had COVID and then you got the transfusion.
I don't know, she's just saying, can you test positive for COVID after having infusion 3 months later?
Yeah, so the infusion, the only way to get it means you had COVID. Okay. And I have seen some people test positive for very long times after they've had COVID itself. You got to remember that the antigen test is looking for pieces of the virus. So after you've killed the virus off in your body, there may be dead bodies of virus laying around your nose, right? And so that's why we don't recommend testing to prove immunity by having negative tests, because I've seen people test positive months after the fact. I mean, I think the longest that I've personally seen was 2 months after he had been infected.
It probably depends on the type of test that you're looking for too.
Right.
They're all antigen. I mean, it would depend a little bit, but I would say your rapids or your PCRs are all looking for pieces of virus, so you could test positive for a very long time.
Okay. One of the questions is, if you have underlying health conditions, can you get the COVID vaccine? Or is there any underlying health condition that you would not recommend getting a COVID vaccine?
I think the important thing here is that if you have an underlying condition, you are the person who absolutely should get the COVID vaccine. Unfortunately, it takes a very, very big toll on people with comorbidities. And I think it's important to remember that
COVID takes
COVID,
things.
yeah. The obesity is one of those comorbidities. You know, it doesn't necessarily have to be blood pressure, diabetes, but if you are just obese and otherwise healthy, that is a very big comorbidity in this situation, unfortunately.
Yeah, I'm trying to think of what I would recommend not getting the vaccine.
I haven't really heard anything on as far as any kind of, like, if you we're not recommending for these people. It's always been, if you have underlying health issues, you really do need to get it, because your chances of getting over it are a little better. So
Right. I think the only people that need to be aware are people that have had severe reactions to vaccines in the past. But even then, those people need to talk to their doctor about it. We are very lucky to have a wonderful pharmacist, lots of wonderful pharmacists in the community, but especially at Drew Memorial. And he has been trained at UAMS, and he's very quick to respond to any allergy type of questions that anybody has.
Yeah, I don't know if there's anything. There's a lot of things that, like Guillain-Barré is something that gets thrown around in the news a lot, and they basically said that even with a history of Guillain-Barré from other things, they would recommend you still get it. I actually know someone who had a known history of Guillain-Barré that got their COVID vaccine. They were fine. I will say, like, out of things that I've seen as far as reactions, the worst has been people that have spiked fevers and body aches and that kind of thing.
I've seen some come in with headaches.
Yeah, or maybe a rash. And if that happens, that's when you talk to your doctor and decide, okay, what's the right next step. But again, if you're having a bad reaction to that vaccine, COVID is going to be much harder on you. You're one of the people that COVID would be particularly hard on. So that vaccine is a small taste of what the real virus would be like.
So one of the questions we have is the booster specific to the original vaccine that you received? For instance, if you got the Moderna, do you need to get the Moderna booster? Or also, is there an idea when boosters will be available for everybody?
Ideally, you'd get the same one that you had initially. If you cannot come across it, then it's okay. But ideally, you'd get the same one that you had.
Except for Johnson & Johnson.
Yeah.
Which Johnson & Johnson is not one that's being recommended for a booster as of yet. It's still too early because it came out in May. So it's got a 5-month lag on Pfizer to get that information. But right now they would say keep within your vaccine if you can. That being said, I do know people that got Pfizer early on, and then they kind of took it upon themselves to get a booster, and they switched and got Moderna, and they didn't turn colors or die or anything else. They had same kind of typical, my arm hurts, that kind of thing, but they're otherwise fine.
I know in this country, this has been an overwhelming thing across the country, that we've seen an age group of 20 to 30-year-olds who have been hesitant to get this vaccine. Can you tell us why? Do you think you know why this age group is deciding not to do this?
Because they're 20 years old.
20 to
They think
30
they're bulletproof. I was 25 once and thought I was.
I think, early on, this was very much hitting the older people. I think that's changed. Now we're losing people in their 20s and 30s. So I think slowly those people are going to be turning around. I really think this infertility rumor has really hurt that age group. And I hate that, but I think that's really been a factor to a lot of people.
I think too, and when I was talking to some people that's my age, we grew up with vaccines. I mean, we grew up, this is what, we had to march down to the health department and get vaccines all the time. And I grew up right at the edge. I mean, polio was pretty much over by the time I came along, but I do know people that were affected with it. And so I think this is one of those things that, to me, is the first time there's been these generations that have never really had to go through a health scare like what we're seeing now. I mean, that was like, okay, I got a vaccine. Let me go get that thing, because I'm just, that's what I have, that smallpox scar. So we grew up that way, and we saw those, like I said, the polio, the devastation from polio and the scare of that, and other things. So I don't know if that made a difference. It's because we've gone so long without a major, health scare that's gone across the whole population.
I think to some degree people do things when it aggravates them. That most of us won't do anything we don't have to, and that for the most part, people in that age group have not seen anyone their age truly suffer from this illness. I will tell you that in the last month, I've put a handful of 30-year-olds on high flow oxygen. I've had to intubate a couple. We've seen pregnant girls under the age of 25 be intubated, the baby be cut out of them, and the baby be immediately moved to a ventilator as well. So this is certainly taking its toll on the younger people. I also think that there's going to be a societal pressure from older people on their children to say, go get your vaccines. So moms need to kick their kids in the butt kind of thing. And I also think you're going to see it from employers because, as we're employers, we have nurses and things that work for us. When you get exposed to COVID and you get COVID and now you're out for 2 weeks as an employer, that's really hard to keep a staff. And I think you're going to see that from all sorts of employers that realize that every time somebody gets sick, they're going to be out for 2 weeks, and it's going to not only is it going to affect them, but it's going to move through their company very quickly. I think you're going to start seeing employers saying, "Get your shot or go home."
That brings me to a question about: do I need to wear a mask and avoid close contact with others if I'm fully vaccinated?
Yes.
Unfortunately.
So the reason, and I've got the CDC's got a great list of the data on masks, and I don't want to get into the argument of do they work. Just for the sake of that argument, just assume that they do, because they do. We all grew up with our mothers yelling at us to cover your mouth. This is the same principle. If you want to get into the semantics of viral particles and moving through that, you can. But the answer is the studies that just look at does it work. By looking at in populations where you put on masks, you see cases go down, you see transmission go down. So they work, whether they work by magic or they work by science or whatever reason, they work. The reason why people who have been vaccinated still need to wear their mask is one is we don't know that, right? So it's going to be hard as a society to say, oh, we really don't want to get into that mark of the beast kind of mentality of if you've had your vaccine, you can walk around and say, I've had mine, I don't have to wear it. The other thing is that we do have emerging variants, and you may not get terribly ill from COVID, Delta, Lambda, Beta, whatever, but you may get it, and then you can then transmit it to somebody who isn't as vaccinated or immunocompetent as you are. So there's still some defense we're playing. Now, once the overall COVID case numbers go down, masks should be able to come off. But I think that the masks have more to do with total COVID numbers.
That's one of the things that we went, once they allowed us to do a mask mandate at the library, we went back to that. And my argument for that was mainly for my workers, because they work together or have to work together, so that like you said, if they get around somebody that has COVID or they've been exposed, I don't have to shut down everything if they have taken precautions and been, wear a mask, try to stay apart. And that's a lot of it. It's just that trying to keep people working, and they don't have to use leave just to be isolated, not whether they're sick or not, just because they were exposed.
Right.
So, well, let me see. Is anybody else getting any? So tell us a little bit about what are the costs of the vaccines? Some people may think that they may not get one because they think it may cost too much.
Sure. The COVID vaccine, the only thing that can be billed by a provider is the actual administration fee, and that typically does go through insurance.
It's actually against the law for them to bill the patient directly. It is you can only bill Medicare, Medicaid, insurance for administration, but the government has definitely taken out all barriers to the patient. You could have nothing on you at all, and they should still give you your vaccine.
Okay, so if somebody right now says, you know what, I think I want to go get it, can they just go anywhere right now?
All the pharmacies,
All the
Drew Memorial,
pharmacies.
Monticello Medical,
Mainline.
I don't know if Mainline has it or not.
I think Mainline had it.
Now Pfizer is only available at Drew Memorial and Monticello Medical. MMC2, Dr. Atkins has it for children, and then I think
City Drug had it. I think
Moderna now. I don't know.
the Pfizer kind of, because it's only good for so long, it's not always in a consistent spot. But the pharmacies have done a pretty good job of advertising whenever they do have it available. And you can always certainly reach out to the hospital and they can tell you where to find it. The Pfizer, and now that's specific for kids. That's the only reason that's important.
And the CDC site for a while was really good. When it first came out, I know there was only two pharmacies or two places in Monticello where you could get the vaccine. But they were really good about updating their website on where shots were available. So
I would also say if you're looking for a shot and you don't know where to find it, if you send either one of us a message on Facebook asking and you need a specific one, we will find it for you happily. So if you want it, just let us know. We'll figure it out.
And they could definitely get in touch with us here too. We can help them find that information. And we'll remind everybody, if you got a question for Drs. Carmichael, put it in chat. We're still talking about, I'm hoping I haven't lost any. I'm trying to look over here at my questions and see if I've gotten all the questions that have come up so far. I'm not seeing anything.
Here's some on the chat from
I think we've gotten most of those, unless you see something I hadn't seen.
He's on Repatha for cholesterol. This is keeping him from getting the vaccine. Oh, it was a direct message. Sorry. That's why it came to me and not everybody.
Oh, good deal.
That's okay. Ask
You
that
know,
question.
we're gonna have to dig that up. Give us a second.
Okay.
See what the
Like I said, anybody out there, just if you have a question, put it in chat.
Why is that? Is that because we've had other people on those like Humira and other medications like that are the UMABs. So basically the immunomodulators.
Tell them which question you're talking about.
This is a direct message. I don't want to put them on blast because they send it to us privately, so I don't want to post their name or whatever. I don't know if she's still on there, but we're gonna give us a second. We're gonna see if it's okay.
Okay.
I did have somebody have a similar question. What they're asking is the specific drug is an immunomodulator medication used for cholesterol. I don't have a lot of experience writing it because it's just not very common. They're saying that has been keeping them from getting the vaccine and are asking our opinion. So we're gonna.
And I just want to let everybody know that CrossFit Pediatrics at Ashley County Medical has the Pfizer for kids. So somebody's sharing that information. So if you're
interested. That's great.
Mm-hmm.
The Pfizer's tough to keep. You've got to keep it like negative 80 degrees Fahrenheit. So it's hard for most places to hold on to it.
I'll text Dr. Garner.
I was going to say too, we just got the news today that the Pfizer vaccine has been FDA approved. Can you tell us what that means?
It essentially was approved. They just kind of taken the red tape off it and said they're finally giving it a full thumbs up. Honestly, I can't go into much more than that because what you're getting into there is more government bureaucracy than medicine. I think all the medical personnel knew that it was approved, and what we were waiting on was the government to finally say oh yeah, it's fully approved. But when it was endorsed prior to that, and it's just one of those things of it had to exist for X amount of time before they could give it that official stamp, and that had more legal reasons than medical.
Okay.
Did the vaccine have any effects on patients whose blood level who are on Coumadin? I would say no. You might have something where you could argue a weird case where if it made you feel sick and you didn't eat, and then it would throw off your INR, but no, it shouldn't in any way. That's all goes to the liver. The vaccine doesn't really affect the liver. Now, that being said, Coumadin itself or a COVID itself is very hard on the coagulation pathways. So that's something that somebody on Coumadin is going to struggle with if they get COVID. Is they're gonna have to deal with those clotting issues. I've heard of ivermectin. I knew this was coming, being used to treat COVID. What are your thoughts? So I've tried to dig in on the ivermectin thing. There's not a lot of good data for it. There is data, there's just not good data. And I'm open to anybody providing me with better data. But what I can tell you is, one is the FDA has come out strongly against it. And then what I have been given has been, there's a group in Texas that is really pro ivermectin. And they're like the FCCC or something like that. They basically are a self-formed group of doctors. They only formed during COVID, and they're all about ivermectin. The studies they quote are stuff out of Africa from like 2000 to 2012. And there are studies that were done on Ebola and dengue and things like that. And there have been some studies done on COVID, but all in all, it's not good data. It's not, when you get into the biostatistics of things, like none of it is really that strong, especially the stuff out of Africa, because you're dealing with an entirely different patient population. I would say that everybody's got somebody they know and they're like, oh, we took so-and-so and we're better. But you got to remember that 90% of people get over COVID without any treatment at all. So we can't look at that one or two cases or even an entire doctors, or that the expert opinion is not worth a lot. You have to look at those large numbers, and nobody with large numbers on ivermectin has shown good data to this point. And that's why I'm saying I'm open to more thoughts, but right now I would say I wouldn't prescribe it.
Definitely don't take anything from that for animals.
And that's another thing. Like, remember that is not the same stuff. The stuff that's at the farm store is not the same thing that we write for people. It's packaged different. It's wrapped up different. It's designed different ways. It's meant to be taken different ways. You can really mess yourself up. I actually read the other day that Mississippi's poison control was up like 400% or something ridiculous because of ivermectin overdoses. So it will tear your liver out. Here's another one. There are many crazy rumors about what to take if you test positive for COVID. Could you clarify on vitamins and things you would recommend? So the vitamin studies, again, came out of other countries. There's been a lot of people writing it. You're probably not going to hurt yourself taking vitamins, but most Americans are not vitamin deficient.
The only one that I've really seen a lot of is vitamin D.
Yeah. Vitamin D.
But I would also, usually people that are low in vitamin D tend to not be outside a lot, not be very active. So then that's another question.
And there's a lot. Vitamin D is like, before COVID, there was always a hot button argument in medicine because you see vitamin D levels drop in chronic illness. So when they extrapolate things out like, oh, these people with low vitamin D did really badly with COVID, it's like, yeah, well, they also, because they had diabetes and hypertension and heart disease, and that low vitamin D was really a reflection of poor health, not a reflection of low vitamin D.
So the vaccination cards, if you lose it, you can go to really any provider that offers vaccines will have access to WebIZ, which keeps records of that, and they can provide you a new card. Local pharmacies should have access to that, as well as the health department would have access to that. Or again, your medical provider should have access to that as well. And
just to clarify with anybody worried about the government keeping track of vaccines, they've been doing that since most of you were born. I mean, all of us are in WebIZ. Every vaccine you've ever gotten is recorded. That way they know who's had what vaccines. And when you go to, I need to get proof of my hepatitis vaccine to go to school, that's what WebIZ is. It's just a database of vaccination.
Yes, we've been doing that for a long time. All my kids had their little yellow cards.
It's the little yellow card online.
Well, and I think that's going to be important too, because, like my husband gets the vaccine and he goes, I have no idea what I did with that card. Right. But for me, I do a lot more traveling, and it's probably going to come up that I may have to show proof of vaccine before flying, or attending other things. So now on that, we should point out that right now the databases are all state
dependent. So if you got your vaccine in another
Sure.
state, you're going to have to reach out to that state to get those records.
Oh, that's good information, yeah.
But it could all be through health department.
Okay, let me see, I think you've done.
Are there other questions?
Yeah, we'll go back
Scroll
up to the top here. See, sounds like one of the professors made her student show up. I love it.
We have
Booster.
We're trying to, like I said, we're trying to monitor Facebook as well, so
Yeah.
some of these are coming from.
COVID, transfusion, ask for that Repath. Did you ever hear from Trace?
I have reached out to our local cardiologist and I'm waiting for a response on that Repatha. I can't see anything obvious, a reason why, but we're gonna wait and hear from him. And
I think that, again, this is very much off the hip here, but I think that this is probably the similar things that I've seen people hesitant to give COVID vaccines to people on like Humira and other similar medications, and that they're worried about that being a problem. I don't see, there hasn't been anything from the CDC saying not to give it. And those patients that I had that were on Humira got their COVID vaccines and they did completely fine on it. But I will dig in more. I'm going to go back to that message and see if we can reach out to that person directly.
You know, it's not funny, but if you ever have to be on some medication and you get the information on that medication and you read all the possible side effects that can happen from medication, you wouldn't take it. I mean, because you can scare you to death, and it just knows that they have to warn you that there is a minute chance that could be a side effect. And I think that was a lot of scare on the vaccine for some people was, oh, there's all these, side effects.
So there's some reassuring things here. One is that the testing that vaccines go through to be approved is extremely rigorous, and an aspirin would not pass those tests. So if you're willing to take an aspirin, you're taking a way bigger roll of the dice than you are by taking this vaccine. And if you look at even, they have to report any and all deaths. If you have had the COVID shot and you die, it gets reported. And so if you look at the number of people who have died and gotten the COVID shot, it's like 6,000 something deaths. And it means like if you walked outside the pharmacy and got hit by a car, that got counted as a COVID vaccine death. You still are less than 0.0019% chance of dying from the vaccine. And that would be like flipping heads on a quarter 8 times in a row. Like you're just not going to do it. Right. So it is remarkably safe. And that doesn't mean that nobody gets side effects, nobody's issues. I would, if you twisted my arm, I would say to get the Pfizer or Moderna over Johnson & Johnson, but I think the data is very good on all of them.
All right, does anybody else have any questions? We'll wait and see if something comes in. Trying to see that, I went through my list. So, and what about still doing the, sanitizers and, I mean, I know, let me rephrase this. Do you think we saw such a resurgent because we saw numbers go so down so fairly quickly, and then it was just like, yeah, we're done. We want to get outside. We want to go and so I think we got on the move again. You feel like we may have gotten on the move a little too quickly?
Yeah, probably. And then the variants, right? Delta variant coming back and being, I mean, it's a different animal. This is not the same thing we were fighting in January. It's a more aggressive. I've seen, COVID before, you'd have a patient in the hospital for 14 days and they'd get worse and worse and worse and worse. And then they'd get worse and we'd try to get them out. And that was part of the problem is they would stay sick for so long as to just tie up a bed for a long time. And then if they were going to die, they might die 14, 21, 28 days into hospitalization. I've seen people die from this thing in 3 days, 4 days. I mean, it can be drawn out, but it can be just particularly aggressive and very deadly very quickly.
All right. Anybody?
Here's another question.
If you are on antiretrovirals, that's a good question. This person asks if you're on antiretrovirals, does that affect your ability to get? So these are antiviral medications. I would say that if you're on antiretrovirals, my money is that you're seeing an infectious disease doctor. And if you're seeing an infectious disease doctor, this is a really good question for them. But that being said, most of these antiretrovirals work against viruses, and the mRNA is not a virus. There's no virus in it at all. So your body should be able to take the vaccine without having to come off those medications. But that is me shooting from the hip, very much so. And you should ask your infectious disease doc.
Good question. See if we have anything else. I can't see if I've missed anything.
I'm enlisting our local pharmacist.
Oh, we're putting, so Brandon Hill, we're going to give a shout out to Brandon Hill. He is our clinical pharmacist at
Drew Memorial.
Drew Memorial, and he's a fantastic guy. And he says antiretrovirals, and he says, nope, go get it. Well, that's about Repatha.
If you test positive, how do you know which strain you have?
You don't. The health department does that, so it's significantly more expensive and time consuming to test for variants because you're looking at a much more small piece of the data to get that. So what they are doing is taking, if they get so many samples in a day of positives, they're testing so many of those, and they're kind of saying, okay, well, 90% of what we tested was Delta variant, so we're going to assume that 90% of the cases were Delta variant. And he says Repatha. He also says Repatha to the person who asked earlier. He says, nope, go get it.
That's a good question. Is there different treatment for the variants? I mean, being treated differently.
No, we have Regeneron now, which is a different monoclonal antibody, just because it's better than what we had before. We're still doing steroids, which that's another thing, going back to the ivermectin thing, is that ivermectin has an anti-inflammatory property to it, and that helps with the infection. I mean, when you're already giving Decadron, you're already strong. Is that Brandon just joined in and said Brandon just joined? Please tell me that's him. It's hard to say that any of that would be as effective.
All right.
Is that Brandon? Brandon Hill, is that you?
All right, well, y'all, we have about 8 more minutes. So if you have any more questions, please get those in right now.
Somebody on Facebook says, for those with severe bleeding disorders who are prone to muscle bleeds from injections, even with pre-treatment, would it be safe to give sub-Q instead of IM? That is a great question. And I don't know that one at all. I would definitely punt that again to
our friendly local pharmacist.
Are you on here, Brandon? You want to just
take
this
I'm on
over?
here.
Hey! Hey, the question is, Brandon, can it be given sub-Q instead of IM for people with bleeding disorders?
No, the current EUA and every FDA approval was just for IM.
Okay. So
there's another question.
How come if you're admitted into the hospital, you can't get the antibody infusion?
I'm gonna give it to Brandon.
Antibody infusion.
So usually when you're admitted to the hospital, you already have severe enough disease to be admitted. In the trials, the antibody infusion had worse outcomes in those patients because they already had antibodies. So you already have antibodies that are fighting COVID off. Giving you more isn't going to help.
Isn't he wonderful?
We told you.
I love it.
He muted for some reason. I don't know why.
I don't know. He might be talking about it.
Barry's unmuted.
Brandon, don't leave us, Brandon.
Well, I'm not. I'm just muting because there's people around me. I don't want them to get in the background.
So did that answer the question, you think?
Yeah,
Yeah,
that's it. I mean, if you've already got the antibodies because you've already got the virus, then giving you more antibodies isn't going to do anything for you. And it actually sounds like there are worse outcomes in people who do receive the infusion. So,
Okay.
So when you're
Right.
normally giving Regeneron, you're catching it very early in the illness before the person's had the chance to build up an antibody response, and you're basically speeding it up.
All right. Any other questions? We're doing good.
Is there a time frame for when boosters will be open to the public? I'll be honest with you. I feel like the public gets more updates on this than doctors do. Brandon,
it sounds like September
September?
So I
is
believe
whenever
the
they're
reason-
planning on it.
Huh?
Yeah, I believe the reason they set the date is September 20th, because that was when it was first available to the public 8 months ago.
I think.
But most pharmacies work under a protocol with the state. And so until the ACIP, which is an organization that deals with recommending immunizations, approves it, most of those won't be able to give it.
What about, I mean, this is just a question from the healthcare. We got it back in December. So, I mean, we're due for it now or no?
That's 8 months.
Or, I mean, we're 8 months now, right?
We'll still have to follow the EUA.
Okay.
Yeah, I think when they said about him coming up in September, it would be available to health people first. I mean, it was not going to be for the general public. It was going to go to health workers first, because I guess y'all were on the front line to get it first. So, dang it.
I'll trade you. I'll trade you right now.
Like I said, hey, I'm ready. Give me that booster. I'll take it.
We that vaccine couldn't have come in at a better time. It got really bad right after we got it. So we all felt a little bulletproof after our first dose, I think.
Yeah.
But after months of being out there and with nothing to shield you, it was pretty nice to get it and then be able to walk in there and have some confidence dealing
It
with
was
things.
definitely I feel like after we got our first shot, it was a night I won't forget. Things were just a weight off of your shoulders. Things were going to be okay.
I think you're right. I think we got that shot and then all of a sudden it was like, oh, I am bulletproof. I can do and go where I want. And then we had to kind of back up and go, okay, wait a minute. I can still get this. In fact, I know of quite a few people that have still gotten COVID after having the vaccines. Like you said, though, it's not as severe. They got over it a little quicker, and then you can give it to the unvaccinated. So then you had to kind of still think, okay, I've got to still step back and put that mask on. And that's what I told somebody the other day, at church, that I had the mask on. I said, I've been around my grandkids that weekend and they go to school in Little Rock. And I said, they're not vaccinated. And I don't want to give any, share anything with anybody else. So,
Right.
But you look at other countries that have more normalized behavior, right? That wearing a mask in, let's say, Japan or Korea, where they wear masks all the time during cold seasons, they had much lower rates of illness because they were basically playing defense right at the beginning. Somebody said, "Why is it vaccinated people? Why is it that they don't have to quarantine if exposed? When if they test positive? It's not the same as non-exposed." So the reason they don't have to be quarantined is that they are so unlikely to spread it. I do think the recommendation is that they do wear a mask if they've been exposed, but they don't have to quarantine. And that's because they're just extremely unlikely to have picked it up when they're also testing positive. Now, that being said, if they're testing positive, they should be considered a positive, but they shouldn't be getting tested unless they are symptomatic. Now, that's kind of one of these areas we run into, which is what happens when you test somebody who's asymptomatic and they test positive. And it's kind of hard to say because the virus, the antigen tests, again, do not convey active infection. They convey that the virus is there and it could be dead, it could be alive, we don't know. So if you're symptomatic and you test positive, you should be isolated even if you have had the vaccine. Is it not the same as a non-symptomatic person who can still spread the virus? And that's kind of building on that yeah, one is you're wearing a mask because you're most infectious right at the beginning of your illness before you are actually that symptomatic. That's the time you are the most likely to spread it. But vaccinated people are just so much less likely. That everything's a statistical chance, right? Like we put these protocols in place when there's a certain risk level that you've hit.
There's another one over there too.
Yeah, there's one here. Let's see this one. It says, do you think masks will be our long-term future? For COVID, I hope not. But it really depends if people get vaccinated up and we take this thing seriously. If we don't, this could be the rest of our existence if we don't deal with this. I mean, the thing that's most likely to knock man off the planet is disease. And I think she was right saying that our generation has not had to deal with a serious illness threat, but this last 60 years is an abnormal thing. The rest of human existence has been plagued by illness, and we may be just returning to that baseline. The other thing is maybe we will be more like Japan and China and other countries that have dealt with they had SARS and other serious, very serious viral illnesses, epidemics, and that's why they to this day still are very defensive against them and wear masks.
And I don't think they'll be in our long-term future. I just don't see everybody complying with it.
We may all be dead,
right.
but
I do wonder if maybe it won't take. Maybe now when people are sick, they'll take more precautions, which would be kind of nice, right? I mean, it wouldn't be weird to see somebody walking around in a mask if they've got the sniffles or a cough or whatever. I wouldn't mind that.
Somebody that usually has bronchitis every year, and this last winter, none, because she said wore a mask. She said, it tells me I need to wear a mask when I go out in public. So,
right.
There was actually a study. It was kind of eerie, or I don't know what the right word for it is, but they came out about using mRNA, not mRNA, about the N95 masks versus regular masks in medical clinics during flu season to prevent flu spread within the office, and it was showing this benefit at that time of wearing regular masks over the N95. Probably more to do with compliance, because anything that's going to make you take it, like those N95s are uncomfortable. You're taking them off, you're putting them on. That is the dangerous thing. Okay. Hand me him. Come here. Okay. So I missed, Lacey Harris was asking about flu shots on Facebook. Can somebody read me that? Because this screen just died that we had that on.
Let's see if I can bring it. But let's answer this one. Will everybody take flu shots as normal, even if you're taking the COVID vaccines?
I recommend it just to read, like we talked about earlier. Flu and COVID are just two different animals. They're certainly dangerous in combination. We've seen that with children that RSV and COVID is a bad combination, and so and that gets into a much bigger case of herd immunity and a whole other lecture with flu shots that maybe we'll do closer to flu season. But yes, you should get your flu shot. The other thing is I think a lot of people try to time their flu shot, right? They think they're going to only get about 3 months of immunity. That's kind of not true. As soon as you can get that flu shot, get that flu shot. You're going to be immune to those strains for the rest of the year. The problem with the flu is that it gets into a lot of statistics where they're trying to predict which flu variants will be the worst. And if they predict right, it works really, really well. If people get their flu shot vaccines, it works. If everybody gets it, you get that herd immunity effect. It works really, really well. But if nobody gets it, flu was one that really relies on the herd immunity aspect. Good evening. Flu cases. So yeah, which Lacey was asking about was decreased flu last year. I think you saw decreased flu because flu is much less contagious than COVID is, and so with all the precautions we were taking against COVID, we were seeing less flu.
Okay.
And then
FDA approved vaccine that more people will get vaccinated.
I hope so. I hope that's maybe what people were waiting on, was to feel like the government really was willing to put their money where their mouth is. I hope so.
All right. Well, I want to thank y'all. This has been a great evening. I want to thank everybody that joined us tonight for our first town hall meeting, and I hope we can do this again. So I want to definitely thank Doctors Carmichaels for joining us with their new baby, Boone,
Thank you.
and wish y'all great success on your new clinic and medical career here in Monticello.
Thank y'all so much.
Thank you. And if
Everybody
you
be
need
safe
to
out there.
find the vaccine or have any other questions, feel free to reach out to us.
All right, we appreciate your help. All right, we're going to say good night, everybody, and see you next time.
See ya. Thanks, Brandon.